So basically just a single case. So is the screen visible?
Yes, yes,
Yeah,
go
very
ahead.
much, very much.
Yeah. So this is a 54-year-old maid housewife. Main complaints of low back pain, very minimal leg pain. But because she's a maid, she's unable to do her daily work of bending and working. She has tried a considerable conservative treatment with other surgeons and under me also. Her DEXA is normal, D3 is around 28, no medical comorbidities. And these are her standing AP X-rays. She has a lumbar is S1, the apex is at L3-4, and this is the X-ray, sagittal X-ray. These are our sagittal MRI films. The L3-4 is the one which was showing a little bit more stenosis, loss of thoracic kyphosis, complete flat back, degenerative scoliosis, and her axial films, the 5S1, S1, S2, 4-5, a little bit more stenosis on the left-hand side, and 3-4 with this. So now the main problem was, being an Indian, she's a maid who works at multiple houses, but she can't do her daily work of bending and working. She has tried conservative line of treatment, but what should be the option given to her? I mean, because her main work, she's just 53. I mean, her main work is going to go on for another 5-10 years.